Diabetes is one of the most common endocrinopathies that you see in small animals. I think that it tends to be causes more health issues for dogs than it does for cats. Cataract develop in diabetes mellitus. You see it in the dog, but not in the cat, which is interesting. There's a difference in their molecular physiology and the enzyme activities in the lens that account for that we'll get to. When you have elevated glucose, blood glucose, aqueous is in a simple form, just filtered blood. So you're going to have elevated levels of glucose in your aqueous. The lens can process that to a certain point, and the lens needs sugar, and it gets sugar from the aqueous that diffuses into the lens and then goes through a normal glycolysis process, an aerobic glycolysis process. When that normal glycolysis process is overwhelmed due to the overabundance of glucose in the aqueous, the lens goes to what's called an aldose reductase pathway, and aldose reductase is probably a compound that some of you have heard about because that's where we're trying to focus our energies on in trying to prevent these cataracts from developing. So when you go down the aldose reductase pathway, you get increases in lens sorbitol and fructose and dulcitol. Those sugars do not diffuse out of the lens back into the aqueous. They stay in the lens. You get a hyperosmotic environment. Aqueous starts to imbibe or it enters into the lens because the lens is now hyperosmotic with those sugars. The lens fibers and cells swell and they turn white. The lens swelling can cause, the lens is formed inside of a capsule. It's always been inside that capsule. Body's never seen lens before because it's always been in the capsule. When you change from having a crystal clear lens to having a cataract, the lens proteins change in such a way that they can leak out of the capsule. Body sees them in low numbers, mounts an immune response, you get your lens-induced uveitis. It happens with every cataract, no matter what. So you'll get a lens-induced uveitis, a little bit of redness. Some dogs show it, some dogs don't. If you take their pressures, oftentimes they're 8 or below, 10 or below. And so even if I don't visibly see a uveitis, I know it's there. These cataracts can develop, and this lens can become so swollen with fluid that it can actually rupture the lens capsule. And then the body is exposed, or the eye is exposed to lens cells and fibers. When it's exposed to those, the immune response against that is profound. It's an amazing immune response, and it's called phacoclastic uveitis. And when they get that phacoclastic uveitis, it's very difficult to control. Very, very, very difficult to control. And oftentimes the eye can self-destruct fairly quickly. Uveitis in rapidly developing cataracts and diabetic cataracts, when owners say they occurred overnight, they're not kidding. They usually will occur within days to weeks. They are that fast in their development. And it is a sign that the glucose regulation is not there yet. Because if the glucose was regulated, they wouldn't be getting these. And so if they went through a stressful situation or something happened, the diabetic cataracts develop. I still see cases to this day that present to me for cataracts, and I diagnose the diabetes because the first sign of the diabetes that anyone noticed was the cataract development. With dog doors and things like that, they can definitely get away with hiding it from you. The uveitis in these cases needs to be controlled, not only to prevent discomfort, but also to prevent the onset of inflammatory-related glaucoma and retinal detachments. So if the inflammation doesn't get you as far as developing glaucoma, retinal detachment will cause glaucoma. So trying to keep these guys comfortable, even if we're not going to take the cataract out. Like I said, the lens swelling can cause capsular rupture. You may or may not be able to see it. Usually you can't see it visibly, but you can see it on ultrasound. To control the lens-induced uveitis, you need to, with phacolytic uveitis, when they're exposed to those low levels of proteins, it's fairly easy to get under control. Topical nonsteroidal anti-inflammatories, and usually initially if they have a significant uveitis or a red eye, I'll put them on oral NSAIDs as long as they can tolerate them. Obviously I avoid oral steroids, but topical steroids I do use. There's no question about it. I've had Labrador owners insist that they were causing their labs' diabetes to become unregulated, and honestly, I think they were right, and I've used them in teacup poodles and not had a problem. So how it works, we're not exactly sure yet. There's actually a study going on right now at K-State looking at a controlled blinded study where they put diabetics on topical corticosteroids and diabetics on non-steroidals, and then they watch their glucose regulation. It's a tough study, and they're doing a pretty darn good job of controlling it to try to figure out how much of this is absorbed systemically, because we know that topical drops are absorbed systemically. They go into the nose, into the mouth, and they're swallowed, as well as they go through the mucous membranes. So we know that they're absorbed, and how is that affecting our glucose regulation? The phacoclastic uveitis we talked about, it's very difficult to control. If not addressed, glaucoma is going to develop fairly quickly. Surgery is the best option, even though they are not good candidates for surgery, because they are inflamed. And I like to control inflammation prior to going surgery, because surgery is going to cause inflammation. And dogs are not four-legged humans. Unlike a human being that's on drops for 2 weeks after surgery and then you're done, dogs are on drops for the rest of their life. The dog eye is different. They're not four-legged humans. No matter if we do or do not do surgery on these dogs, they are on drops for the rest of their life. It's as simple as that. And the owners, I tell them that time and time again during my first cataract talk and during the second time I see them and whenever I see them, because I need them to know that, or they are going to develop glaucoma and retinal detachment. The treatment for cataracts, to remove them, the only known treatment that works right now is phacoemulsification, and then normally we do put artificial lenses in, if at all possible, to allow these guys to focus. Without a lens, they can see. They're what you and I would consider legally blind, but they get around and they do really, really well, and the owners don't. You know, if they cannot run into the wall, owners are happy. I would rather have an artificial lens in there, but there are sometimes lens capsule tears and things like that that don't allow you to put the lens in because you need a capsule to put it in. Suturing lenses in where the way they do in some people is fraught with complications in dogs, again, because of their inflammatory response and their ability to bleed. So it tends not to work as well. Like I said, surgery is the only known treatment once the cataracts develop. What we're finding is that if you can keep them from developing, and not just through good diabetic control, but if you can keep them from developing from stopping the lens from going to the aldose reductase pathway. So aldose reductase inhibitors, both topically and or orally, can inhibit the development of diabetic cataracts. Now, Kinestat, which is an topical aldose reductase inhibitor, is phenomenally expensive. And there are ongoing studies right now using this. And I actually looked at being the three of us that worked for iCare here in Kansas, looked at being part of this clinical trial. And the hard thing is that everybody got the drug free for a while, and then it wasn't free anymore. And then if you took them off the drug because you couldn't afford it, they got cataracts. So it's a hard one right now, and I can only think about how expensive it's going to be, because I see how expensive some of the things out there are on the market that people are putting in their dogs' eyes when they already have the cataracts, and they're just wasting. It's just money being dropped on their dog's face on a daily basis, unfortunately. It can't clear the cataract once it develops. You stop the drug and the cataracts come. It prevents the progression from the very early state. So you can have bladder cells, you can have those initial changes, and it'll hold it there. But if you have any more than that, they wouldn't even put you in the trial because they know it won't work. Oral OcuGlow, some of you may have heard of OcuGlow. It's similar to Ocuvite for people, except for it's formulated for the dog, and all those things that the USDA wouldn't let them, all the levels of antioxidants and free radical scavengers that the USDA wouldn't allow for people, they allowed for dogs, and so you've got a vitamin that is catered to the dog. It's not inexpensive, but if owners want to do it, I definitely encourage it for both just its antioxidants and its free radical scavengers and its ability to help the situation that is abnormal in the eye.